Dr. Michael Briones, thank you so much for coming out to the GOMA Pediatric Seminar. We greatly appreciate you taking time out of your schedule. Why don't you tell everybody a little bit about what you're doing these days?
So a little bit of a background. I did my training at Des Moines University, got my DO degree there, and then went on to Emory to do my pediatric residency and fellowship. Then for the longest time I did leukemia, lymphoma, clinical research for about 10 years, and then went into more of a hematology research. So I do a lot of general hematology with bone marrow failure, your anemias, and then also now doing a lot of the vascular anomalies that we see in our hematology program. So I'm part of the Vascular Anomalies program at Children's Healthcare of Atlanta, where it's basically a multidisciplinary or interdisciplinary team with my colleagues who are interventional radiologists, pediatric surgeons, plastic surgeons, ENT, dermatology, and we see all types of vascular anomalies from simple hemangiomas to more complex vascular syndromes. Been doing this for 20 years and really enjoying it. So,
you know, initially, I guess when you talked about it initially, I was thinking it was just going to be cosmetic, but there's certainly more serious things that can happen with these.
Right, yeah. So a lot of these vascular tumors or malformations can be associated with different types of syndromes. So part of our job is trying to figure out whether they do or not, and do they need further imaging or further testing, in really trying to take care of the patient holistically, because if they do have some particular syndrome, then they need to be followed lifelong, and to try to prevent and catch any type of complications that at least what we can try to predict. So yeah.
And then I guess I was totally unaware about propranolol and its uses in this situation. Maybe you could talk about that a little bit.
Sure. Propranolol really started in 2008. Kind of was found serendipitously, incidentally, by a physician in France. And as you may well know, we used to treat hemangiomas with steroids, a lot of prednisone, and they all get cushingoid. And now the main medical therapy for hemangiomas, if you're going to treat, is propranolol. So that's been our mainstay. There's been a lot of research has been done to it, and there's still ongoing research. You know, when you think about it, it's only 10 years old since in its inception, so there's still a lot to learn.
Yeah, and then also sometimes topical timolol.
Right, that's been kind of like when the families don't want medical therapy because they're scared of, you know, the potential side effects of the propranolol, then we sometimes come to a compromise to say, you know, most families say, yes, I want to treat, but I don't want propranolol, then we can kind of say, let's do the topical. We'll try that, and families are much more comfortable with that. So,
super. Well, great.
Yeah.
We appreciate you taking time out of your schedule and battling with the snow today.
Yes. Hopefully we'll get home.
Yeah, you definitely will. You definitely will. I guarantee it. All right. Take care.
Thank you.